Patelloformial pain. Hey, my name is Amy and welcome to my channel, a place where I combine both my passion for running and for music. Today we're continuing on in part 2 of my running injury series. Running can have huge benefits on your health, especially your cardiovascular and your mental health. It's also a great way to make friends, and just the running community in general is awesome. However, there is a slight chance you might get injured due to a few factors. Some of these is that your body's just not ready for all the impact if you just suddenly increase your training, your natural biomechanics are just the way you move, or having just a poor running form. In today's video, I'm going to cover 6 common running injuries, their causes, indications you might have this injury, recovery advice, and what to do when coming back from these injuries. I'm not a medically trained professional, so when in doubt, please see one. The main reason I made these videos about running injuries is to provide you with information about potential training errors, recognize signs of possible injuries, a little advice to help with recovery, and suggestions to hopefully prevent it from happening again. I want you to be healthy, happy, stronger runners, but also informed ones too. Okay, big speech over with, but it's just something that I really wanted to share with you. On to running injuries. Okay, the first common running injury that I'm going to cover is runner's knee, or the fancy term for this is patelloformial pain. All my medical friends, please forgive me. This is pain around or underneath your patella or your knee. It is the result of excessive friction between your ITB and the lateral femoral condyle. This could be caused by excessive pronation, downhill running, and sudden increases to your training load. One indication that you might have this injury is that your knee hurts during a run. It can also be painful during everyday activities, and stairs can be really painful too. There's a few treatments for runner's knee. The first one and the main one is to decrease your training load, or just take some rest days. Maybe take a short break from running up and down hills. Take a look at the shoes that you're wearing. Maybe it's time for them to be retired and get new ones, or they might not be the proper shoe for your activity or just the way you land or run. You can also get physical therapy where they can assess your gait and make sure that nothing natural in your body is causing this runner's knee. You can also do short-term pain reduction by taping or bracing the area. Now let's talk about a few things that might help prevent you from getting runner's knee again. One thing you can do is to follow a proper training plan, or just keep track of your training and make sure you don't increase your weekly kilometers too suddenly. It's also important to strengthen your quads, hamstrings, your hips, and your core. You can also use a lacrosse ball to release your TFL, also known as the tensor fasciae latae. This release is really good for people who sit down for work or have recently increased their training load for running. I wanted to share a few exercises that you could do to strengthen these target areas, just so you can have an idea of how to maybe prevent runner's knee from happening to you or just happening again. Hip openers help with hip stability, which also can affect your knees if you have unstable hips.
To do the hip opener, stand tall with your hands on your hips. Raise one knee so your thigh is parallel to the floor, keeping your hips level. Using your glute muscles, rotate your hip and torso, not moving your stance leg, and return to your starting position. I do 15 to 20 repetitions per side, about 3 to 4 sets.
Leg lifts are really good for your core, as well as your legs too.
Lie on your side with your bottom leg and knee at a 90-degree angle. Extend your top leg and lift up and down. I do 8 to 10 of these each side, about 3 to 4 reps.
Okay, so now we've kind of recovered from this injury. How do we get back to running? Recovery times can really vary for coming back from runner's knee. You have to use pain as your guide for returning to running. It could potentially take you 4 to 6 weeks to recover. You can do low impact cross training like swimming or pool running that will help you maintain your fitness while you slowly get back into running, or while you're recovering from runner's knee as well. It's really important to slowly add kilometers each week. I would also avoid hills for a little bit until you're really confident that you're recovered fully from runner's knee. The second injury I'm going to cover are shin splints, also known as medial tibial stress syndrome, or MTSS. It's really important not to confuse shin splints with stress fractures, and I'm going to talk about stress fractures after this. Both of their symptoms are really similar, but the treatment is completely different. Shin splints can either be the inflammation of the tendon or the area where the tendon attaches to the bone on the inside of the leg. Shin splints can be caused by natural biomechanics, or in particular, overpronation of the foot, which causes stress to the inside of your leg. Also adduction, which is a narrow step width, or a lower running cadence. New shoes with a very different heel drop than your old ones, or cumulative impact from suddenly increasing your training load. Now, a few indications that you might have a shin splint are: your shin is sore and tender, or mild to severe pain on the inside of your leg or your tibia when you run. For shin splints, the pain is usually covered in a longer area on your tibia. A A few ways to treat shin splints other than seeing a trained medical professional is to reduce your training load or your running load, making sure that you're warming up and doing pre-run activations as well as cooling down properly, and just doing some stretches in general. Correcting the overpronation with stability shoes, and specifically targeting strength training for your soleus and tibialis posterior. A few exercises for these are heel drop. This is really good for your plantar flexor muscles and your Achilles tendon.
To do the heel drop, place your forefeet on a step. They should remain in contact with a step during the entire exercise. Focus on your calves and Achilles tendon as you raise and lower your heels. Keep your feet hip-width apart and raise your heels as high as they can. I do 6 to 8 repetitions around 2 to 3 times.
Ankle turnout. This works on your lateral stabilizers.
Secure your resistance band ankle height and wrap it around your focus foot. Slowly rotate your foot to fully invert it. Then slowly rotate your ankle using a scooping motion to bring it back to a relaxed position. I suggest doing 3 to 4 sets of 6 to 8 repetitions each ankle.
And finally, ankle turn in, which targets your ankle inverters.
Similar to the ankle turnout, but this time moving against the resistance band to bring it inwards, slowly moving your foot back in a scooping motion. I suggest 3 to 4 sets of 6 to 8 repetitions.
Returning to running from having shin splints is very similar to other injuries. Again, it's a good idea to do low impact cross training like cycling and swimming, yay, so you can maintain your fitness while you're recovering from this injury or just slowly incorporating running back into your routine. You want to avoid putting stress on your tendons and shins too quickly, or you could re-injure yourself again. If pain, even if it's slight, is still present when you're returning to running or recovering, maybe avoid running on hard surfaces or doing hills in particular. And of course you can incorporate hills into your training again, but maybe just add them gradually. In general, with shin splints, you just need to give your tissues time to heal. The third running injury that I'm going to cover is the dreaded stress fracture. Stress fractures are tiny cracks in the bone that can occur in several parts of the body, like your hip, femur, foot, but most common is the tibia. They occur when muscles are fatigued enough that they can't absorb the added shock. Eventually, the fatigued muscles transfers the stress to the bone and causing a tiny crack, which is a stress fracture. Studies have shown that stress fractures are more common in the winter when we have a reduced amount of vitamin D in our system, and women are more prone to them when they have a low BMI. A few indications that you might have a stress fracture is that you have a small focus area of pain on your tibia, or any part of your body, really. Again, the main difference between a shin splint and a stress fracture is that a stress fracture is small and the shin splint is a large area of pain. Another indication is that you're not able to hold weight on it. You can do a test called the hop test, is where you stand on one leg and hop up and down. If this is painful for you, you might have a stress fracture. Having the small focus area of pain when you're running is also an indication. To treat the stress fracture, you need to stop running immediately. If you continue to run on a stress fracture, you could make the issue much worse. I definitely recommend going to see a medical professional, and sometimes they don't even show in an x-ray but a bone scan. It's also a very good idea to see a physical therapist so that they can give you specific exercises for you to recover from it. Make sure you're wearing the proper fitting shoes, and review your training log. Maybe you're not taking enough rest days. Returning to running is really individual and could take from maybe even 6 to 8 weeks or even longer. Returning too soon, too quickly can make it worse, and it's better to let it heal properly and then start running again, as hard as that may be. The last thing you want to do is get sidelined even longer. The fourth running injury is the ITB syndrome. I briefly talked about this in my foam rolling video, but I wanted to go more detail in this video. ITB syndrome is an inflammation of the long fibrous tendon that extends from your hip to below your knee. Its main function is to stabilize the knee, assist with inward rotation, and hip adductors, which help support balance and alignment. Some say that women are a little more prone to this syndrome because they have a wider pelvis than men. And a wider pelvis means greater rotation, which puts strain on the IT band. Pain is most commonly felt on the outside of your knee. You can almost feel sometimes a knot as well. One reason you might get the ITB syndrome is a sudden increase in your training. I feel like a broken record, but it really does cause a lot of problems and is a contributing factor to a lot of these injuries. There are also biomechanical factors that contribute to ITB syndrome. A few of these are weak glute muscles, narrow step width, increased hip adduction, and overtype hip flexor muscles that can occur when you sit down a lot for work. It can also be caused by an abnormal movement of the femur bone. A few suggestions to treat ITB syndrome are ice and heat. I go into detail in part 1 of this video series, so feel free to check that out if you want a more detailed explanation of what to do with the ice and the heat on an inflammation like the ITB syndrome. You might have to get your gait retrained by a professional, especially if it's caused by a natural biomechanic. It's probably a good idea to reduce your training load, as that will give your body time to kind of work through that compression and heal and just kind of maybe get rid of that tight knot. Pushing through the pain is never a good idea. Here are a few suggestions to help prevent getting the ITB syndrome. I would definitely recommend strengthening your hip adductors. I'll explain a few exercises that you can do. First off is hip hike. It strengthens your hip adductors.
To do the hip hike, stand tall with your hands on your hips. Keeping your knees aligned, bend one knee at a 90-degree angle. Slowly use your stance leg glute muscles to raise and lower the opposite hip. Hold for 2 seconds and lower as low as you can. 3 to 4 sets of 6 to 8 repetitions is good for this exercise.
Another great exercise to do is clamshells with a resistance band.
To do clamshells, lie on your side with your knees stacked on top of each other and your feet touching. Keeping your bottom leg on the ground, raise your top knee, then slowly return to the starting position. I like to do 2 to 3 sets of 12 repetitions on each side.
And lastly, the hip extension, which works on your gluteus maximus.
First, wrap the resistance band around the ankle of the focus leg. Stand tall, feet hip-width apart. Slowly use your glute muscles of the leg with the resistance band back, only as far as your hip motion allows. Do not arch your back or tilt your pelvis. Then slowly return to the starting position. I would do around 3 sets of 15 to 20 repetitions on each side.
When coming back from ITB syndrome, you want to increase your mileage or the kilometers you run in the week slowly. I would probably avoid hills until it's fully healed. And lastly, to warm up before you go for your run and make sure you cool down properly after your run too. This helps prevent tight spots like the ITB syndrome. The fifth injury I'm going to cover is the Achilles tendinitis. Achilles tendon is the inflammation of the tendon that connects your lower leg calf muscle to your heel. This inflammation is caused by excessive stress. This excessive stress could be caused by a lot of hills, rapid increasing in your training, whether it's duration, speed, or intensity, sprints, and not warming up properly before you run. One sign that you might have Achilles tendinitis is that it's super painful to walk on your feet in the morning. Pain in this area at the beginning of your run, though it may go away after your body gets warmed up. You may also experience calf tightness and foot pain as well. This is due to the altered force distribution in your ankle and foot. How to treat Achilles tendinitis. Definitely seek professional help first. Temporarily reduce your training load or even take some time off. Things you can do while you're recovering from the Achilles tendinitis is ice the affected area several times a day, especially after an activity, whether it's running or cross training. Strength training is really good too, just make sure it doesn't put any extra stress on your tendon. It helps you keep up your strength while you recover from the Achilles injury. Dynamic calf stretches are really good to do. You can also do specific exercises that will strengthen your lower limbs, which will then fortify your stride and protect your tendon. When you're coming back to running after your Achilles injury, make sure you don't come back too suddenly. If it's caught early on, you could return to running sooner. If not, it could be months before you're recovered. It's most often the case with tendon injuries that you can't actually use pain as a guide, as it usually takes 24 hours for pain and symptoms to appear to show you that you've overdone it on your tendon, and by then it's too late. The sixth and final common running injury I'm going to cover is plantar fasciitis. This is the most common injury to the bottom of your foot. Plantar fasciitis is the inflammation of the thick band of tissue that runs on the bottom of your foot from the heel to your toes. It's common in runners and people who don't run either. One symptom that might indicate that you have plantar fasciitis is that the bottom of your foot is super tender to touch. You're in pain when you put weight on the heel. Pain also shows up in the morning or after a brief period of inactivity. So what causes plantar fasciitis? One major contribution is rapid increase in training. Do you see a trend? Running on hard terrain can also cause this to flare up, or new or unsuitable shoes to your feet. This can be running or casual shoes too. Why were ballet flats so popular? Why do I still love them? And why do I still wear them? They're just so pretty and impractical. So how do you treat this injury? If you seek professional medical help early on, it will improve your chances of recovering quicker. I would highly recommend going to a specialty shoe store and get the shoe that fits your foot the best. Then, introduce these new shoes gradually by rotating them with your old ones. Our body doesn't like sudden changes. I would also suggest doing calf strengthening exercises that target your plantar fascia and your intrinsic foot muscles. The first of these exercises is the calf stretch.
Calf stretches really help improve the flexibility of your calf and Achilles tendon. Rest your hands and arms on a table and lean forward, keeping a soft bend in your knee. Bend one knee and raise your heel off the ground to bring the weight onto your forefoot. 15 to 20 reps per side is a really good start.
Foot doming.
This targets your inner foot muscles. Sit with your knees at a 90-degree angle. Start with your focused foot flat on the ground. Draw back the ball of your foot towards your heel to raise your arch in a dome shape. Keep the outside of your foot in contact with the ground and try to keep your toes relaxed. You can do 3 to 4 sets of 10 to 12 repetitions.
Resisted toe.
To do this exercise, place a resistance band around your big toe. Then, maintaining tension in the band, raise your big toe off of the ground. Pushing against the band, slowly lower your big toe and hold for 3 seconds and repeat. I suggest doing 3 to 4 sets of 10 to 12 repetitions on each big toe.
Coming back to running after having plantar fasciitis depends on the severity and the duration of the pain. Again, it can sometimes take up to 24 hours for you to feel pain if you've overdone it on your tendon. So lack of pain isn't always a good indicator that you're healed. It just takes time and consistently not being in pain. I would avoid speed work until it's fully healed as well, and coming back to running gradually while also doing some low impact cross training, like cycling and swimming. If you were doing low impact cross training while you were injured and you're now getting back into running, it's important to remember that you might actually have to reduce the amount of cross training you do while you're slowly incorporating running into your schedule. Your body and your bones actually need time to adjust to the load of running, and it can't if you're also doing a high intensity of cross training. And you might actually re-injure yourself if you try to do everything at the same time with the same level of intensity. I know injuries may feel embarrassing or just discouraging once you get them because you just feel like you did something wrong. And yeah, maybe you did, but it's also a time that you can kind of be aware of how your body moves and maybe its natural tendencies, and that you can use this time, again, to become a stronger runner. Being informed and aware is super key, especially in regards to injury prevention. Injuries happen, it's just how we deal with it is the important thing. My hope is that the information that you were given in these 2 videos on running injuries will help you become more informed and aware, and just maybe help prevent you from getting these injuries. Running has changed my life so much for the better, and I've met so many amazing people and the supportive community, and I just want you to be happy, healthy, stronger, less injury-prone runners who enjoys running like I do. If you've had running injuries in the past and you have any advice or just friendly encouragements to people who may have injuries right now, please share them in the comment section below. As well, please let me know if there's any topics you'd like to see me cover in a video. If you like this video, tap that thumbs up button. Feel free to check back next week for a new video, or you can simply hit the subscribe button and the bell icon so you get notified every time I upload a video. Happy running, and I'll see you next time.